All regions of the country are seeing increased concern when it comes to mental health, with 50% of those surveyed now in the high-risk category of the Mental Health Risk Index. That's up 8% from 2018. And Canadians have been increasingly turning to medication to help them deal with their mental health issues. 30% of Canadians say they're in that category, up 9% since 2018. But Canadians are increasingly willing to speak to someone about their mental health. That number is now over 50%, up 10% since 2018, and up more than 20% since Ipsos started tracking mental health in 2015.
As we see these increases in talking about mental health, which is really encouraging, right? We want people to be talking about it. We want to end the stigma. The more people talk about it and the incidence is going up, it's kind of a chicken and the egg. But at the same time, I would agree with you that we are in a bit of a crisis mode for sure when we've got, it is exactly 50% who we would qualify as at high risk of a mental health episode. 1 in 2. That's, pretty undoubtable. But the more people are talking about it, this is a good thing. And we've seen particularly more people talking about it online. We're doing a lot more online these days, speaking to each other online right now. So, this is very encouraging. Yeah, we see that a lot. We have 19% say they're talking about it online. I don't know that it's necessarily from having more resources. I do think it's more about getting more comfortable. More people are talking about it. That's one of the silver linings of the pandemic is it kind of opened up the conversation about mental health because people were suffering more and we were, increasingly told to be more empathetic with each other and check in on each other. But the increase in the people who are talking about it with their primary care providers hasn't gone up as much. So I don't think that it's necessarily that there are more resources. It's going to take us a long time to recover from the pandemic. As much as we want to put it behind us and we are, moving towards putting that behind us, it'll take us years to come out of this. And there are other things that are going on that do affect our mental health. We know, for instance, that women are suffering more or seem to be suffering more than men. Young adults in particular, people from lower income households, maybe not a surprise there, but as we continue to have those divides on socioeconomic status, of course, if there's a correlation there, that's still going to remain there post-pandemic.